Hey, what's up everybody? Today we're going to be going through 3 things that you can do to start getting that knee totally straight. So achieving full knee extension is really important whether you're preparing for surgery or recovering after surgery. You need to have that knee straight in order to walk properly, and if you can't walk properly, then it's going to affect everything else up and down the chain. So we did a video before where we do all the exercises on the floor, we stretch out on the floor and engage the quads on the floor. And I wanted to give you something that you could do in standing as well, because sometimes it gets boring to do the same things over and over again. So what I want you guys to do is just find a step. You can use like a little ledge or a stair. If you have just one stair to get into your house, that's perfect. And what we're gonna do here is we're gonna start out with that hamstring stretch. So we're gonna bring the heel down, toes up, hips facing forward, and then you're gonna hinge back until you feel a stretch right above the knee behind the leg in that hamstring. So as I'm doing this, if I'm feeling like there's too much sciatic nerve tension, that icky nerve tingling pain, then you can relax the foot down a little bit more, and maybe you'll even get a little bit deeper into the stretch. But the focus here is the hamstring. So we want to get that mobility above the knee. If we don't have the flexibility above and below the knee to get the leg totally straight, then we're never going to be able to get the leg totally straight. So we're going to work on some passive stretching here first, holding it for a minute on each side. If you have one side that's affected, then you're just going to do that one side. Holding the stretch for a minute is kind of like our maintenance phase. If we're really looking to make changes in that muscle tissue length, which you might be doing at home if you're, like I said, you're preparing for surgery or recovering from surgery, then you're going to have to hold the stretch a lot longer, that 3 to 5 minutes. So as I switch legs here, I'm doing the same thing. I'm pushing the butt back. I'm drawing the stretching leg hip back and pushing the other leg forward to keep those hips squared off towards the front of the room. Now, if this is too hard on your back or you're having a hard time doing this position and not engaging the right muscles or feeling it in the right places, then go ahead and check out the other video link below where we do all the same moves on the floor. This is just an alternative to give you a different way to do the same thing. And we've got about 20 more seconds here, really isolating that stretch above the knee, feeling it in that hamstring muscle. Most important thing about stretching is that you come in and out of the stretch nice and slow with control. You don't want to slingshot that muscle and feel super tight after, cause any micro tears or anything like that. So for the last 5, 4, 3, 2, and 1, and then slowly come on out. Now I'm going to take my way up onto the step, and we'll stretch out one calf at a time. So I'm going to come back here, drop the heel down, let the toes lift up, and you're going to feel that stretch now in the calf muscle, so right below the knee. And again, if you're feeling tight, if you're not getting that full stretch, hold it longer. Do that 3 to 5 minutes to get the changes in tissue length. If you're working on your maintenance, then you can take it down to that 30 seconds to a minute. So we're going to do a minute here on each side, holding on to something for a little bit of support just so you have that balance and that stability. Not forcing the stretch and seeing how much we can feel it, but just getting to that point where you feel the stretch, letting it melt, and then maybe sinking a little bit deeper, thinking about Laffy Taffy if you were going to stretch it. 10 more seconds here. For 5, 4, 3, 2, and 1. If you're focusing on that one leg, feel free to repeat it with me, but do it on the same side. I'm just going to be doing both legs here because hypothetically speaking, I would be in the maintenance phase. I do have that full knee extension. If you don't have it, remember you're holding those stretches a little bit longer. And just breathing into the stretch. Anytime you're stretching, you want to try to find the most comfortable position to do it in so that your body doesn't have to work so hard to maintain the position. If I feel like everything else is getting tense all around me and I'm not able to relax that muscle, then you're not going to get the full benefit of the stretch. So halfway, 30 more seconds. Maybe sinking a little deeper, maybe you're still feeling it and you're just holding it where it's at. Either way, whatever is good for you. Last 15 seconds here. For 5, 4, 3, 2, and then slowly coming out of it. So now you're going to have something where you can anchor a band to. So whether that is a super heavy dining room table, something that's not going to move, you want to take a TheraBand and wrap it around, loop it around that stable surface, tie a little knot on one end, and we're going to do something called a terminal knee extension. So it's going to activate that quadricep muscle, the muscle right up here above the knee. And what that's going to do is actively engage that quadricep to get some active knee straightening. Everything that we just did with those stretches is passive, meaning that you're just holding a stretch and letting it work. You're not activating any muscles. This, we're gonna turn that quad muscle on by pulling the knee straight, squeezing that muscle above the knee. And so you're pushing the knee into the back of the band, and you're gonna hold it for about 10 seconds, and then slowly release. Good, we're gonna go for 5 times here. So the goal is to engage that quadricep muscle. This way you can get the knee straight in an active movement like walking or climbing the stairs. But if you don't start out and have that flexibility first, then you're never gonna be able to do it. And maybe you're still not at the point where you can get the knee totally straight. That's A-okay. Go to where you can, and just as long as you feel that muscle engage, you're doing the right thing. Anytime there's swelling in the knee, even if it's so minimal you might not be able to see it on the outside, it's gonna impact and inhibit that quad. So you're gonna have a harder time engaging that leg muscle if there's any swelling inside the knee joint. Sometimes it's helpful to engage the other side as well. So I know in the video that we did on the ground, I did both legs at the same time for you so that you could feel that contraction and have some carryover to get the other leg moving as well. Last one here. Good, and maybe it's getting a little bit easier. Maybe that mind-body connection is starting to kick in and you're really feeling that quad engage. That is the goal. You want to be able to feel your body working those active voluntary muscles. So you can flow through a few more reps of that, maybe go through this whole series 1 or 2 more times, but focus on getting that knee straight, because I promise if you're doing it before surgery, it's gonna make your recovery that much easier. And if you're doing it after surgery, it's one of the first major goals. So get it done, get started, good luck.